right, you've read the title. You know what we're here to talk about, the dreaded number 2. As a recovery nurse, one of the issues that so many people have that I get questions about on the internet and questions about from my recovery clients is going number 2 after surgery. Why is it so hard? What makes it so difficult? And what can we do to possibly prevent these issues? We're going to talk about it all in today's video. For those of you who don't recognize my face, my name is Nikita Lene. I am the owner of Respa, where we do cosmetic surgery recovery. And today we're gonna jump right into what are the causes behind not being able to go poop after surgery. So I'm gonna talk about the top 5 reasons of why it's so hard to go. And then we're gonna talk about some ways to help you so you don't have this issue. The number 1 reason most people have issues with going to the bathroom after surgery is because of anesthesia. Anesthesia causes everything in your body to slow down, and that includes your GI system, which causes the digestion of your food to slow down and causing you to have sometimes constipation. The number 2 reason are opioid pain medications. Now, this form of pain medication is most commonly prescribed after you have any type of plastic surgery or a lot of the big surgeries in general. And these medications have a tendency to cause constipation. The number 3 reason is immobility. After surgery, the number 1 thing you're gonna worry about doing is sleeping and resting. The lack of being up and moving as much as you usually are is another reason why it's going to slow down your digestion. What a lot of people don't realize is when we are up and moving, all of our big muscles are moving and it causes our gut to move. So without those big movements and you being up and being active, it's going to automatically slow down your digestive system. The next thing that makes it hard to go to the bathroom is dehydration. Now, dehydration is very common after a big surgery. Number 1, you have to fast prior to your surgery, which is going to increase your risk of dehydration. But on top of that, most people after surgery just want to sleep and get their rest, which causes them to drink less water and eat less food than they would normally eat. Dehydration makes your stools harder, which makes them harder to pass, thus causing constipation. Last but certainly not least are changes in your diet. You may make changes in your diet leading up to surgery, and then of course you fast before surgery, and the lack of fiber in your diet changes the normal flow of your poop and your poop cycle that you are normally already on, and that can cause your bowel movements to slow down, thus causing constipation as well. One last reason that I see a lot of people having a hard time going to the bathroom is the fear of the pain. Now, just anticipating your first bowel movement after having a surgery like a BBL can cause a lot of nervous feelings and can cause a weird feeling of anticipation. A lot of clients will feel like they have to go, and then when they get ready to go, they tense up and they're not able to. So this is another added reason of why so many people have a hard time going. Next, let's talk about 5 ways that we can mitigate these issues of using the bathroom. Starting with number 1, hydration. Now, staying hydrated is going to help to keep the contents of your bowels moisturized, which is going to keep it easier for those things to keep moving. So hydration mixed with number 2, which is eating fiber, are going to help your poop to be able to leave your body a lot easier without the added stress of straining and pushing, which you definitely don't want to do a lot of at this time. Increase the foods that are high in fiber in your diet, such as fruit, vegetables, legumes, and other high fiber foods. That's going to help to continue the progress of making your poop a little bit heavier, which is going to help it to exit your body a lot faster. If you're finding it hard to get the proper amount of fiber in your diet naturally through fruits and vegetables, you can always add a fiber supplement. They come in many different forms, so you can take the fiber gummies or you can add the fiber into your drinks in the powder form. Either or are going to help you with your fiber deficiency that can cause the constipation. Next are stool softeners. Stool softeners like Docusate are going to make the stool softer, making it easier to pass. Now, we talked earlier about the fact that you don't want to strain or push exceptionally hard, which you could find yourself doing if you are dehydrated or constipated. So things like this Docusate are going to soften your poop so that you don't have to put that extra strain and stress on your body. Number 4 are laxatives. Now, depending on your situation and how long you've been constipated, laxative may be necessary to help to stimulate your bowels to start moving. Some clients who are having constipation and they still haven't had a bowel movement after a 3rd or 4th day after surgery may want to look into using a laxative like Miralax. Miralax is a little bit softer on your belly. It can be mixed in with your drink and it can be taken in increments to kind of help to stimulate the bowels to start moving and to help stimulate that poop to kind of come out. Now, you have to be careful with laxatives. Make sure that you are following the instructions. Overuse of laxatives can cause the opposite issue of having diarrhea. Knowing that you could already get dehydrated from surgery, diarrhea would be one of the worst things that can happen. It's going to even further dehydrate you. So use caution when using laxatives. Don't take them too closely together. Allow your body the time to actually absorb the medication and to allow the medication some time to work before you take a 2nd, a 3rd, or a 4th dose. Because at this point in time, you definitely do not want to end up with the opposite issue, which is going to further dehydration and other issues. Last but not least, one of the most important tips I can give you is physical activity. Like we spoke about earlier, getting up and moving around is going to move some of the bigger muscles in your body. Those will stimulate your gut to start peristalsis, which is going to encourage your body to go to the bathroom. If you feel like you're having a hard time going, get up and start walking laps. You can also add stretching in the mix, and you can additionally start to massage your stomach while you are walking. All of these things are going to help to stimulate your gut to start moving, which is exactly what we want. There are 4 major things you want to look for that can be concerning and may be time for you to call your doctor. So let's chat about them now. The number 1 is severe abdominal pain. If you are having really bad abdominal pain where you're completely doubled over and you're really having a hard time going to the bathroom, this could indicate that there's some type of blockage or additional complication. Monitor the situation over a couple of hours and make that decision if you feel like you need to contact a provider. If you do have a nurse that is taking care of you, your recovery nurse, report your findings to your recovery nurse. They may have some additional tips and tricks that can help you to encourage your body to go to the bathroom, but definitely contact somebody about having this type of issue. Next, if you have not had a bowel movement after 4 days. Now, everyone's body is different and how often you use the bathroom is going to be different from other people. Some people only use the bathroom every other day or every 3 days, and maybe that's normal for your body. Pay attention to your body and how your bowel movements are going. And if you have tried all of these tricks and none of them seem to be working, contact your recovery nurse or your provider to find out what to do next. Last is vomiting. Now, vomiting can be a sign that there is extreme blockage in your gut. This can be a sign that what you're eating is not getting through to be digested because you have a complete blockage. So if you do find yourself vomiting, not just because of like normal nausea that you're experiencing, but it's coming after you're eating and you're feeling like the food is just sitting in your stomach, has nowhere to go, and you find yourself vomiting after, definitely contact your provider. This could be a serious sign that you do have a blockage and that you need immediate attention to help you to go to the bathroom. Next are bloody stools. Now, we spoke earlier about not straining, but after having to go to the bathroom for a long period of time, naturally a lot of people want to kind of clamp their bodies down and just push. This can cause you to have hemorrhoids. This can cause you to burst the blood vessels in your rectum, which can cause bleeding. If there is an excessive amount of bleeding, you want to contact your recovery nurse or your provider because this can be bad if there is an excessive amount of bleeding. If you found this video helpful, make sure you subscribe and hit the notification bell so you don't miss out on any more of our content. Thank you so much for watching, and make sure you catch our next video on how to prepare for your BBL. See you guys in the next one.